Hello, my name is Ian Bazan, and I will be presenting a recommendation report on the best form of cardiac rehabilitation for post-cardiac trauma patients. An overview of my presentation. I will give a brief introduction on cardiac rehabilitation and what it is, my methods of research, results of the research, my conclusion, my recommendation, and a list of references that I used. So, an introduction to cardiac rehabilitation. So, 45 to 67% of cardiac patients were referred to a cardiac rehabilitation program, with only 27 to 41% attending their outpatient cardiac rehabilitation, which is pretty low. It's less than half. So, about 15% of heart attack patients may experience another heart attack within the first year of their first heart attack. I also conducted research into cost, adherence, effectiveness of the alternative methods of cardiac rehabilitation, and alternative methods are telehealth, internet-based, and home-based cardiac rehabilitation. My first task was to identify alternative types of cardiac rehabilitation. So the types of cardiac rehabilitation are the traditional method of cardiac rehabilitation, which is clinical cardiac rehab. So as defined by Taylor, 2010, traditional cardiac rehabilitation refers to center-based cardiac rehabilitation based in a variety of settings. For example, hospitals, physiotherapy departments, university gymnasiums, and community sports centers. Telehealth, as defined by Hong 2015, telehealth cardiac rehabilitation refers to phone, internet, and voice conference communication between patient and healthcare providers. Internet-based, as defined by Zutz 2007, internet-based cardiac rehabilitation refers to using the internet as a medium for delivery of an interactive virtual cardiac rehab program to patients at a distance. And home-based, as defined by Taylor 2010, home-based cardiac rehabilitation refers to a structured program with a clear objective for the participants, including monitoring, follow-up visits, letters, or telephone calls from staff, or at least self-monitoring diaries. My second task was to identify comparable criteria between the methods of cardiac rehabilitation, the overall cost of the program, adherence of patients to the program, which for some patients could be lifelong, and the overall effectiveness of the program. And to define effectiveness, we compared, um, well, first of all, cost effectiveness, as well as total cholesterols and things like body mass index and blood pressures. My third task was to find out how this affects the outcome of cardiac rehabilitation, how all these factors come together. So to do this, I use Google Scholar, the Alkek database, and PubMed to find scholarly articles to compare raw data. And one of the articles I found was a systematic analysis of 83 different articles. And so we used the criteria from task 2 and compared the numbers that I found. Continuing on with my results, here we have a 6-month program cost from Carlson 2000. And as you can see, the mean number of sessions with echocardiogram monitoring was more than $1,000 cheaper for cost-modified protocol. So this is a comparison of traditional protocol, which is clinical cardiac rehab, to a cost-modified, which could be telehealth, home-based, or internet-based. And the overall cost on average was almost $1,000 less than clinical cardiac rehabilitation. Continuing with the results, here we have cholesterols compared from the modified protocol to the traditional cardiac rehabilitation. And all of these numbers, you can see that modified protocol, there is a greater beneficial change in percentages as compared to traditional clinical cardiac rehabilitation. And these numbers here are weight, body mass index, anaerobic threshold, resting heart rate, resting systolic blood pressure, and resting diastolic blood pressure. and all of these numbers show a greater beneficial change, percentage change, from modified protocol to traditional cardiac rehabilitation protocol. So there's a better change in everything other than clinical cardiac rehabilitation. It's much more effective for the patient. So in conclusion, uh, all the alternative methods of cardiac rehabilitation have a better cost, a better adherence, and are more effective than traditional clinical methods. Alternative methods are more convenient for the patient, and the three alternative methods discussed, although slightly different, are all essentially the same because they all take place outside of a clinic, and most of them are at home. Just the means of the program are different, such as like using a telephone or internet or cardiac rehabilitation is coming to the person's home. So in my recommendation, in most cases, it is the patient's best interest to be given any one of these alternative methods. They are all more effective cost, adherence, and overall health effectiveness than the traditional method. Here are the sources that I used to find this data. Thank you very much.